We need that long-term investment in our public health infrastructure. And if COVID didn't show it, I don't know what will.
Taking the lessons of the pandemic seriously and using data to get ready for whatever comes next. Public health saves lives. Yesterday, today, and tomorrow. A Public Official of the Year is making it happen.
TFIC takes you deeper into the stories that are shaping the future of state and local government.
To boldly go where no man has gone before.
You're not Buzz Lightyear.
I'm Siri.
And I'm Google.
And I am Alexa.
Alexa seems so smart, I think we'd have a lot to talk about.
Pew, pew.
From governing and government technology, this is The Future in Context. With Paul Taylor, I'm Ashley Silver. Our special October series on the class of 2024 Public Officials of the Year continues this week with a profile on Dr. Philip Huang. He is the Director of Health and Human Services for Dallas County. As you would expect, he had a leading role in the response to COVID-19. But for him, the pandemic only underscored his long-held contention that better public health relies on better data. Governing's Carl Smith returns to the podcast to talk with Paul about what he learned about a family physician who went public.
Governing Senior Writer Carl Smith, welcome back to the big show.
Thanks. It's nice to be with you.
We are celebrating the return of the Public Officials of the Year after a 6-year absence. All told, it's about a 30-year tradition at Governing to recognize some of the best in public service. Introduce us to your POI.
The person that I wrote about for Governing is Philip Huang, the Director of the Dallas County Health Department.
His origin story is unique and interesting. He talks about a pivotal experience in Nepal and some advice that he got along the way that kind of steered him into public health. Tell us a little bit about that story.
Well, he was originally thinking he would do family medicine, and he had some practice there, but one of the people who was an advisor to the program that he was in suggested that he might want to do an internship in Nepal, working with people in that community.
I had already matched for family medicine residency, but did a rotation my senior year in global health that was co-sponsored by Johns Hopkins School of Public Health, and went out to a remote mountain village in Nepal and really became interested in international public health. So that faculty person from Johns Hopkins first said, you should think about getting a master's in public health at some point. And I came back and talked to my infectious disease professor at UT Southwestern Medical School, and he said, you should also think about a program at CDC called the Epidemic Intelligence Service. And I kept both of those things in mind as I was entering my family medicine residency, and just, just really liked the potential for having more population impact throughout. I loved family medicine and I loved the clinical pieces, but then I also was drawn to having a broader impact.
So given that background, talk to me a little bit about kind of the mission, purpose, and scope of his work in public health.
I think he had a good recognition of the broad range of people's needs in the community. And I think he wanted to find ways to help them as broadly as possible, as many different types of people as possible. He comes across as a very compassionate person, detail-oriented. As part of his training, he did research projects for CDC and had a real data-driven idea about public health matters. So I think that also connected up to the idea to get into the weeds, not treat this as a big generality, but recognize there are lots of different species of humans out there who might all have their own needs, and that it would be smart to understand them and their needs, and then try to address those.
There will come a day, someday, when the words public health and COVID-19 aren't inextricably linked. But COVID-19 had a real influence or impact on public health. What does Philip come away with thinking about in terms of the needs for lasting infrastructure or policy changes as the result of having managed through the pandemic?
In some respects, they have to do with mindset. He was not happy that topic had become so polarized and that political divisiveness got in the way of any kind of suggestion, whether it's based on data or not based on data.
Something exactly like COVID and the experience that we did go through. So it was, hopefully a once in a century type of event, but it was certainly a dramatic public health event that affected every single person, very seriously, and whether shutting down workplaces, things like that. And so, that was, I think stressed the public health system as much as anything can. We all tried to learn from previous lessons and things. It certainly gave many people in the general public more perspective on what public health does. There's some funding cliff for public health that we're worried about coming up shortly, where some of the funding that came out from COVID then is no longer going to be available. And we need that long-term investment in our public health infrastructure. And if COVID didn't show it, I don't know what will.
We're going to have another pandemic, and yet, even with COVID, we haven't yet, in a big way, in a way with real political will and funding behind it, recognized that we are going to have that again. And what do we need to be doing now so that we're not caught by surprise once more? Because we know it's coming. And so I think in some ways, the biggest things that he took away were that we've got to get the polarization and politics out of it. And we've got to reconcile ourselves to the fact that we need long-term strategies.
Part of a long-term strategy, I think, by my reading of your interview with him, goes to data modernization in public health, because the data informs decision-making. Unpack that a little bit.
Well, that's absolutely true. And that was one of the things that they ran into in the beginning in their own, in Dallas County, was some of the things they had were paper, some were being sent around by fax, some were in databases. And it really, when you have to make decisions in real time, when something is moving fast and in unexpected ways, you have to have the best possible data. And they really began to build it up, and they managed to make pretty quick progress and really achieved pretty remarkable success in terms of keeping cases down, therefore really building trust with the community because they were doing a good job.
When people used to ask, what keeps you up at night? I mean, it was probably something exactly like COVID and the experience that we did go through. So it was, hopefully a once in a century type of event, but it was certainly a dramatic public health event that affected every single person, very seriously, and whether shutting down workplaces, things like that. And so that was, I think stressed the public health system as much as anything can. We all tried to learn from previous lessons and things, but it certainly gave many people in the general public more perspective on what public health does.
And I think it didn't hurt also that he was out in the public speaking. He's a good communicator, someone you could easily warm up to. And that, combined with good data and better data, they were able to prove a proof of concept.
On the trust issue, it's one thing to earn it once. It's another thing to maintain and grow it. Did he talk to his ideas or his approach to building out that most scarce of public assets?
They've continued to sort of build up a portal, a public health portal, where the public can find information, where they share data with them and be out there, be visible, and be transparent about what they know and what's going on in the community.
I feel very fortunate that our community, and I certainly had the support from our county judge and our county commissioners, a lot of the community partners. I mean, still to this day, there are people, I'll be walking around in the community and someone will stop and they'll say, "Oh, I recognize you. Thank you for what you did." And I mean, by far, I feel fortunate that that's what a lot of the feedback that I get from the community, from many members, that have, really said they appreciate that what we tried to do and to get the messages out and to reassure the public and provide information about, what was the current status.
Did your conversation touch at all on both opportunities and challenges in Dallas or in public health generally about what comes next and perhaps something that he's excited about?
In terms of what he's excited about, Dallas has been recognized nationally as a leader in data infrastructure, and he's out consulting folks all around the country. And also, there is funding and motion toward building a better public health data infrastructure, and he's very much involved in that. I think he sees potential there. On the other side of the coin, I think we don't have enough funding. He'd like to see more funding. Without more funding, some of these things won't get implemented at the scale they should be.
We've received more, funding support, but unfortunately, we've seen something like this happen before in the past when there are these public health events and emergencies that get a lot of attention, whether it's Ebola or H1N1 or Zika. And, we get this roller coaster of attention and sometimes resources. But then historically, it's gone down and then back up when there's some other event. But, one would think that something like COVID so dramatically impacting everyone, and we're hoping that, okay, well, now everyone's going to really get it.
Dallas is a big and important community, yet it is only one community. His thoughts on the interactions necessary for a sustainable and growing public health effort that involves local communities such as his, along with state and federal players. How does that come together in his mind?
Well, one of the things that others said about him is that he's unique because he's worked at every level. And again, it's a little bit like the example of the politicization of things. Different people at different sectors have different ways of looking at things. It's a little bit like the story of the blind mice who all go out on an elephant, and depending on where they land, they decide what the elephant is. I think that he understands what a federal person is thinking and seeing when they look out against the public health landscape isn't the same as what a state person would see or a local person. He's able to put himself in their shoes a little bit and communicate across those constituencies.
Also the community outreach and, the disparities and making sure that our services and testing and vaccinations and things reach all of the population and that we can, address all of the community. And we have disparities throughout our community. And we've been, building a lot of our community outreach efforts to make sure that we can be where the population, the community are, and address a lot of the barriers to care and to services. But also, we're trying to address those barriers upstream. And we're actually a health and human services agency.
One of the other things that makes him unique, like you, he's a musician. And even as we record this, there are guitars hanging on the wall behind you. Talk to me about his musical background and how working in a band taught him about collaboration and the process of making music in the public health space.
Well, he's an accomplished trumpeter, and he's played in ensembles of all sorts, from Dixieland to classical to he's apparently exploring jazz a bit now. And I think the thing that's really interesting and, unique in a certain way is, being in a music ensemble is a very specific kind of working together. It's an intimate kind of team activity.
There's been a lot of sort of links between music and sort of development of mathematical, skills, but then also being in a band or musical group, I think, sort of teaches you and allows you to live in working together, learning how to work together with people to get a common product, and whether it's producing beautiful music or other things, but it's that goal in mind and learning how to work with people. And some of my best friends to this day are some of the people that I grew up through, high school band with. So I've always valued that, and I think it's an important piece for people to learn a lot of other skills.
It's a way of working together that maybe is a little more ideal than government work can always be. And the other thing that's interesting is the team is all working together toward creating something beautiful and experiencing that beauty in real time. Now, that's a high bar for government, perhaps, but ideally government would be working somewhere close to that band in terms of creating something that really benefits the people that they serve and having at least some sort of experience when they accomplish that makes them realize as a team they did something good.
Thank you for your reporting on this. Your feature is with the others in the fall issue of Governing Magazine and also available at governing.com. Carl Smith, thank you very much.
Well, thank you.
Hey, it's Ashley. Next time, our colleague Thad Reuter will join us with a look at another member of the POY class of 2024. Rob Lloyd has brought a little Silicon Valley swagger to the city of Seattle, where he serves as CTO. Our editorial team includes Theo Douglas, Zoe Manzanetti, and Kelly. Our editorial team includes Theo Douglas, Zoe Manzanetti, and Kaylee Tedrow. Paul produces the show. Our executive editor is Noel Nell.
And that will do it for us this time out. For Ashley Silver, I'm Paul Taylor. Thanks for listening. Always forward.